that is really what most dental hygiene departments are running on. And, the question of, is hygiene profitability possible? It's extremely difficult if that is the core of your services. And when I say core, meaning if the majority of your services fall into those categories, right? Adult, child prophies, and some bite wings.
Right.
Today, for multiple reasons, we'll say first and foremost, just because we know from science and research that patients that have active inflammation, whether that be gingivitis or periodontitis, they have a higher risk for all kinds of health implications.
Hello and welcome to another episode of The Champion Dentist. I'm Mike Kulwiec. And we know, as dentists and team members that dentistry is a team sport. And a really important role on the team is that of the hygienist. And today I am honored to have with me Rachel Wall, who is a hygienist by profession, by education, going back numerous decades, over 30 years. But she started a company which I consider to be the number one company for hygiene consulting, and that's called Inspired Hygiene. And she's been doing that for over 20 years. We're going to talk about hygiene today. Rachel, welcome. I'm so happy to have you with us.
Thank you. I'm so happy to be here, Mike. I appreciate the invitation.
Well, let's get into this. There's
Okay.
two things that I think I would love to cover with you. And one is profitability in hygiene. And then the other one is one that's become a challenge for some dental practices, which is finding great hygienists, right?
Mm-hmm.
Post-COVID, things changed. Is that
Yes.
okay with you? Does that sound like a good set of topics for us
Absolutely.
to cover? Because I
Let's
know
do it.
you're an expert on both of these. So let's talk about this world of hygiene profitability. And let me
Okay.
just start with that fundamental question. Is it possible to be strongly profitable in hygiene?
Yeah, that's a common question that we hear today. And the reason why we're hearing that is because, as you said, our industry has changed in the last few years dramatically, particularly where it, involves hygiene profitability, hygiene compensation. But at the same time, that hygiene compensation was increasing because of this supply and demand issue that we've had, the last 6 years. The other thing that's happened is the cost of everything else in the dental practice has gone up. The cost for everything that we're purchasing, gas, food, all those things, regardless of, our role in the practice, have gone up. And for those practices that are in network, a lot of reimbursement has gone down. So as you know, there's a crunch there, right? There's a crunch with business owners because this hygiene profitability benchmark is based on a very basic business principle of your revenue minus your expenses should equal profit. There should be something left over, right? That's the only way that the business is going to be able to be sustainable, that the business is going to be able to reinvest in its team, in the facilities and equipment, and all of that. And so the dental hygiene department really is a business within a business. And so that's why there is this metric. And so a lot of dentists are looking at their hygiene department and saying, gosh, now that we're paying, $50, $60, $80 an hour, depending on the different regions of the country, it's really difficult for us to be able to see hygiene, profitable. And we can get into the details of like, what is the math on that, Mike?
Well,
But that's
you
where we
use
are.
this word benchmark.
Mm,
Okay, so let's just get with a number here
okay.
together. What is one benchmark that you think dentists should be aware of?
Yeah. So the long held benchmark for hygiene profitability is that the hygiene department should be producing 3 times hygiene compensation.
Okay, 3 to 1.
And 3 to 1, that's the benchmark, is a 3 to 1. And what that allows then is if you look at the hygienist's total production, a third of that will cover overhead. And overhead in the hygiene department is everything that happens in that operatory, all the usable supplies. If there's a lease on the equipment, that's part of overhead. Hygiene payroll taxes is part of overhead. And then a third of that production would cover the compensation, right, including benefits for those hygienists. And then there should be a third of that production left that's going back into the practice. And that's really where, when dentists are doing math or when they're working with strategic advisors like you're looking at that particular number and seeing like, okay, are you at 3 to 1? Are you at 2 to 1? Are you covering the cost of the hygienists, or are you even, are you even in the red, in that area?
Well, let's just put the train into the station for a minute.
Okay.
And if a practice owner goes, I'm 2 to 1 or I'm less than 2 to 1, that's where you come into play,
Hmm.
right? Because as we both know, it's like, how do I figure this out? It could relate to pricing, could relate to productivity. Those are
Yeah.
the two primary drivers here. So tell us a little bit about how the, if you will, generally, how you approach a situation where that 3 to 1 number practice is not there.
Hmm. Yep. So that's one of the things that we look at really early on in an engagement, because we do a deep dive audit of the hygiene department and look at areas that are really strong. What is working well and where are there opportunities to grow and improve? And so if we see a practice that's at 2 to 1, then what we know is they're producing enough to cover the overhead and hygiene comp, but there's no profit going into the practice. And so instead of, often with dentists, a knee jerk reaction will be, okay, well, maybe we're not going to have as many hygiene days, or we're going to shorten hygiene appointments so we can get more patients in. What they often don't look at is more of the holistic approach of like, what are the services that we're even offering in hygiene? How is there a way to elevate those services so that first it's delivering a higher level product and service to the patients, and that in turn can increase production. So, like you said, there are multiple ways to impact that figure, but that's the longest term, most sustainable way that we have found.
So if a practice is aware of the number and they're not working with someone like you, my impression and what I've experienced with clients is they struggle. They're trying to find the answer,
Yes.
right? So what what I think you and I both know, and this is what you're so good at, is like, look, let's just get clarity here. You have been of service to one of my clients where, boy, the dive that you did before getting into being of service to them, there was a whole bunch of information that you asked for. And it took a commitment on the part of the practice to get that information to
Yep.
you, right?
Yep.
I participated in a chart review.
Yep.
It was incredibly well detailed. Well, that's what you've got to do. And in order to make things better, you have to measure.
Hmm.
What you measure can be made better.
Hmm.
So one of the things that I see you doing is to overcome the struggle, overcome the frustration, and this sense of confusion and bewilderment is you put your arms around the tree and say, what do we have here? And that does require getting a handle on the numbers and understanding exactly where is the practice. Does that sound right to you in terms of how you approach things?
It does. In our conversation before we started recording, we were talking about a situation where we need to ask some questions so we have the facts so we can make the best decision. Without the facts, we're just throwing things against the wall, and often it's emotional. It is. If it's a if it if we're talking about an independent dental practice, which is primarily who you and I work with, right? It's the team member talking to the owner, and whether or not you want it to be personal, it gets personal, right? Because that owner is the one that's writing the paychecks. So get the facts, where do we have opportunity to grow before we just kind of take a knee jerk reaction and either risk losing a hygienist that's really valuable to the practice, or before we shorten appointment time that's going to impact all different parts of the practice ultimately. Let's look at the facts and let's see what can be adjusted to get that department, that piece of the business back into a more sustainable place for the long-term financial health of the business.
One of the things that I've perceived in working with you, Rachel, with you and your team, is that you wind up elevating the hygiene program. And
Yes.
hygiene, and I've been around dentistry a long time, and my awareness of perio and hygiene is it's become more sophisticated. and more beneficial in terms of what can be done for the patient. And that speaks to the mix, right? The mix of what's being offered today. And I see practices where they're behind the times
Hmm.
in their programs. So let's talk about that service mix and the impact that it has, not only financially, but on the health of the patient and what that does also for the hygiene team.
Yeah, we see that too, Mike, that a lot of practitioners are behind the times. And these are practices that are they're practice owners that are calling you or that are calling Inspired Hygiene. They are they are top tier dental practices. If you're reaching out to work with a coach or consultant or business advisor, like you have a certain level of acumen to at least be open to that and to work with people or to watch a YouTube like this, right? Like these are top tier and they're still struggling with these things. Okay, so the base the base hygiene services are, a prophy, adult prophy and bite wings. Maybe there's a panoramic x-ray, an FMX here or there. Maybe there's some adult fluoride, a couple sealants, a month, that kind of thing. That is really what most dental hygiene departments are running on. And, the question of, is hygiene profitability possible? It's extremely difficult if that is the core of your services. And when I say core, meaning if the majority of your services fall into those categories, right? Adult, child prophies, and some bite wings.
Right.
Today, for multiple reasons, we'll say first and foremost, just because we know from science and research that patients that have active inflammation, whether that be gingivitis or periodontitis, they have a higher risk for all kinds of health implications. And so, first and foremost, it's our responsibility as healthcare professionals to provide the highest level of care. So, diagnosing that inflammation and providing a solution to that is going to uplevel the patient's health. And all of a sudden, now the hygienists aren't just doing prophies. Now they're doing non-surgical scaling root planing. Now they're doing periodontal maintenance. And now we can even start to add things like adjunctive laser therapy or antimicrobials like PerioProtect or PerioDT. I even had somebody mention at a course I was teaching at this week, or last week rather, about using platelet-rich fibrin in periodontal pockets after non-surgical scaling root planing. So these are things that are coming, that are here. They're not just
Right.
coming, but they're here. And so this is where the dental hygienist can really step into that role as healthcare professional and bring a ton of value to the patients, to the practice. And by the way, it's exciting. It's boring doing a prophy all day long. This is where if we're willing to step out of our comfort zone as hygienists, we can really step into a really exciting way of practicing.
You make an interesting point there, comfort zone. And change is part of growth.
Yes.
And we know, look, we get into a routine
Yes.
and we get comfortable in our routine.
Yep.
Well, we are in a scientific business, an
Hmm.
evidence-based
Hmm.
healthcare profession. And so therefore, we have to remain open
Yes.
to what is the highest and best degree of care that we can provide to the patient. And that's why I look at what you're doing with hygiene today and where I'm guiding clients is it is so different than where it was in 20, 30 years ago. And
Yes.
the tools that are available to us. And this approach regarding what's going on with perio is a health sustaining, health improving activity. This is not smoke
Absolutely.
and mirrors. This is
Yep.
serious medicine, serious dental health science that's being applied here.
Hmm.
So, my perspective, and you can speak to this more than I, but I believe that if I'm a hygienist, it's like, well, you know what? I've been doing this for 20 years, and yeah, it is kind of boring and I'm comfortable, but this is really cool. And
Yeah.
now I'm practicing hygiene at a different level
Yep.
than I learned 20 years ago. I think that's a fantastic thing.
It is a fantastic thing. And I love the way you put that, Mike, of, we must be open to the evolution of science. I mean, that's the nature of science, right? Is that we're always learning and growing. And so as healthcare practitioners, like we must be applying that highest level and seeking out those things. And then it takes a team, right? Because it takes that dentist then supporting the hygienist to work in that level. Because the dentist has to educate themselves too, right? If the hygienists bring it in, they've got to know what's being performed, right, in their practice. They have to be able to back that up and make sure that it fits within their practice philosophy. But then also the dental assistants, the business team, like everybody must believe in that level of care and what's being provided. But yes, that you're 100% correct.
And
And
and that
yeah,
and this is exactly why I want to go into. I'm gonna call it the inspired hygiene train, the choo-choo
okay.
train. Okay, and because I love the idea of bringing the inspired hygiene train, choo-choo train into a dental practice. Okay, it's just like I've created, Rachel. I've not shared this with you yet. A program for Invisalign. Invisalign is not a marketing campaign that you do on Meta. It is a whole system.
Yeah.
And what I've identified is an Invisalign growth system involves the whole team. There's training
Yep.
involved. There's metrics involved. And what you've done is you have already done what I'm doing in the world of aligners, which is we want to have a system.
Yes.
Inspired Hygiene has a system. And so let's talk about what you do when it comes to, okay, a doctor's interested. They want help. As I understand it, they can get help online. They can learn a whole bunch. They can do an audit and learn and do stuff online. That's one service. The next service is where you're going to provide a higher degree of analysis and coaching and interaction, but that's all done digitally, like we're talking here via
Yep.
Zoom. And then here's the one that I really like. And to me, this is where you get the biggest bang for the buck. And that is you come into the office and you
Hmm.
have amazing coaches.
We do.
And so it's not just Rachel. Yeah, I would love it if I could clone Rachel. I'd have love to have 100 Rachels out there, but you've got some wonderful coaches. So the point is that you put your rubber to the road, you get into that office and you're
Hmm.
there, and at your highest level program, you're there 2 different sessions, 2 days,
Hmm.
session one, session two. And I really want practices to hear about that program
Hmm.
because, guys, gals, those of you that are listening, if you really want to take your practice to the NBA level or the WNBA level, women's basketball. Wow, has it changed? It's so exciting to watch now. So let's get to the WNBA for our hygiene team. So can you spend a few minutes with us just talking about
Sure.
that? I believe
Yeah.
you call that your Elevate program, right?
We do. And that
Let's talk
really is
about that.
thank you, Mike. That really is our flagship program that we have been offering for 22 years. And of course it evolves, right? Based on science and what we're teaching and what we see really gets results. So the beauty of our Elevate program is that it does combine that deep dive audit of the hygiene department with virtual learning with a coach on site. One of the things that I think is really our secret sauce, which is not so secret, but our sauce, we'll say,
Mhm.
is that before the coach ever shows up in the practice, the team goes through some very specific and directed learning. And that helps because here's the thing is, doctors make decisions about the practice because it's their business. And then often the team finds out after the fact, like, hey, we've engaged with Inspired Hygiene. They're going to come in and help us elevate our hygiene department. And then the team is like, what the heck is about to happen, right? That is normal. Particularly if they haven't worked with a coach before, or it's been a while since they've worked with a coach, or maybe they had an okay but not great experience with a coach or consultant in the past. So if that coach just shows up then one day in the practice and the team really doesn't have any information about what they're all about, it's really tough for them to kind of accept that coaching. So,
Right. Yeah.
change is hard. And we're talking about, changing like our workflow and the way we, speak to patients and how we're diagnosing, like really evaluating our diagnosis and treatment philosophy. These are very personal things to a dental team. And so the way that we kind of guide teams before the coach comes in to do some learning ahead of time, it really gives them some comfort to know that, okay, this is a system, like you said, this isn't a fly by night individual that's just going to come and tell us to change everything. There is a reason, there is science behind all of this. And this is a reasonable approach. And guess what? I believe as the team member, it helps them develop the belief that, okay, yeah, it's time for us to really revamp our systems in hygiene because we are a little behind the times based on the research that's out there, the oral systemic links, the AAP classification system, all these things that have really been, they've been real for almost a decade now. And many practices aren't quite there yet. So that gives them a lot of comfort and confidence. And then when the coach comes in the practice, then they really can hit the ground running. They have already built some relationship with the team online because we do a virtual kickoff. And they're just there in the practice, they're building relationships, and then they are sitting down right next to those hygienists and really finding out like what are your strengths? What are the things that maybe are getting in your way? And sometimes it's logistics or like mechanics in the practice. Sometimes it's communication obstacles across the team and with the doctor. Sometimes it's leadership challenges. And sometimes it's just mindset. Like, you know what? I just need to recognize that I can't do things the way that I've always done them for 30 years. It's time to evolve my standards of care.
So,
And
and
that's
then,
really what makes the difference. Yeah.
and beyond that, though, you also wind up working with the entire team, not
Yes.
just the hygiene team.
Yes.
And why do you do that? What happens there that elevates them? Why is that important?
Well, I mean, if you think about it from a really simple example is if we're working with a team to elevate their periodontal diagnosis and treatment system, and these hygienists have been seeing these patients for 15 years, and and a good majority of them have inflammation, then they're going to be recommending a lot of periodontal therapy. Well, it's only fair to the business team to understand why are you recommending all this therapy? If they're the ones that are presenting the financial arrangements for it, they need to believe in it just as much as that clinician does. So
Yeah.
we want to
And
include them.
and
Yes.
and absolutely. And again, this is the paradigm shift is this is evidence-based.
Yes.
This is dental science. It's
Yes.
not like we've come up with some smoke and mirrors thing.
That's right.
This is all legitimate health-based that is in the health best interest of that patient.
Yes.
And it's the difference between, if you will, behind the times hygiene program and state of the art. And you help that practice become state of the art. And as a consequence, if I'm part of that team, it's like, you know what? I'm really proud of where we are as a
Hmm.
practice. We've elevated our
Hmm.
program. We are state of the art. You know what? That's a really cool feeling to have,
Yeah.
right? When you know you are part of a team that's dedicated
Yeah.
to being the best when it comes to the profession of dentistry.
Yeah. And it takes time. And the other thing we do is we really work to meet the practice where they are. So some practices will come to us and they've invested in hygiene coaching in the past and it's just slid back or it just needs to be dusted off and get everybody re-energized and recommitted. And then we work with some practices that have never over 30 years had any type of periodontal diagnosis system in place. And so those two teams are going to work at a different pace to get from where they are currently to state of the art, right? Because
Right.
some of them kind of have a leg up because they already have this kind of belief system. They just got to get re-energized with it. Um, and and we also do it in a way that honors their practice culture and the relationships that we've built with patients. So again, if there's a team that's really starting from scratch, then we're going to take their approach might be a little bit slower. And it might just take a little more time to get their confidence up and get those muscles of having those conversations, ready and primed and, for them to see that treatment acceptance and those patients really embracing things. So we really try to tailor it, even though we have a clear framework, tailor it
Mm.
to their approach. Yeah.
So let's close the loop here.
Okay.
So not only do you make that you prep, education,
Yes.
relationship, and then the on-site for 2 days. But wait, there's more.
But
You,
wait.
you come back. You come back again. And
Yes.
let's talk about that. What's the gap? How long is the gap between the first on-site and the second? And what's the purpose of that?
Yeah. So typically it's about 3 to 4 months between the first visit and the second. And on the second visit, I would say 95% of our clients on that first visit, we're focusing on refining or helping them create a periodontal program. Occasionally we will have a client that says, you know what, really the first thing that I would like is I really want to get all my hygienists consistent with how they are teeing up restorative treatment. And so we can shift there. But that's typically what we do on the second visit is we see, okay, these things are in place. The hygienists have developed some confidence, right? They've developed a good handoff system with the doctor around the perio piece. So now let's translate that to restorative. Let's help the doctor educate the team on their treatment philosophy so that they can get confident recognizing needs when they're doing their hygiene exam and starting to educate patients of what those potential needs may be. And then that, it really, sometimes hygienists think, well, why am I doing all that work for the doctor? It's like, hey, guess what? When we as hygienists can tee things up for the doctor and make that exam more efficient and faster, those doctors are going to be a lot more likely to come in for a hygiene exam when you call them, and they're going to spend less time in your room, and it's going to be more effective.
Do you have a perspective on incentives for members of the dental team, including hygienists?
We do, absolutely.
Okay,
Yes.
so I mean that's certainly a human nature for us. Is like okay, if
Yes.
we're going to create more success for the team, is there an incentive for me? And I'd
Yeah.
love the fact that you have that as part of the process. That
Yep.
you present that, if you will,
Hmm.
to the doctor and team. But the other factor that we have to look at is okay. We worked with Inspired Hygiene. It's 6 months later. It's a year later. Wow, we've really gone from here to here to we're now at the top of the mountain. But guess what? People retire. People
Yeah.
move. People leave. And sometimes we lose good people,
Hmm.
and not because we were bad, but because
Life.
they decided to
Yeah.
retire, or they're going
Yeah.
to a different area, or they want to just be at home for whatever reason. They can
Yep.
afford to do that. My point is, one of the things that I've come to understand with your company is like, okay, well, guess what? You're not starting from scratch. We're still here for you, and
Yep.
you have access to this system, this technology, this learning. Can you comment on that, please?
Yes, so we do. So clients that go through Elevate, they can stay engaged with us for as long as they would like and have access to all of their our online learning. We have onboarding videos that they can use with team members. And honestly, we recommend all of any new team member, whether it's a hygienist or a business person, anybody on the team, go through that onboarding process because it also gives them an understanding of like some of the common language that we teach that's helpful for the team to be calibrated on what are they calling things in hygiene, and yes, so we absolutely have that option. And we have a lot of clients that work with us for a period of time and then they come back a few years later and they want to do the whole Elevate program again because it was so impactful. So there's a couple different ways that folks can stay in touch with us or they can come back through our coaching.
So let's now go to a different part of our time together,
Okay.
which is we're growing, or Mary's retired. We need
Yeah.
another hygienist. Yeah, I think you have three insights on how to
Yeah.
find a great hygienist. I'd love to know what those insights are.
Yeah, I have a lot more than three, but we'll at least touch on those.
Okay.
I
Sounds
would
good.
say I would say the first thing, Mike, really is now, right now, whether you're hiring or you're not, is really cultivating an attractive team culture. Dental practices now are really tasked with not only marketing for a good, healthy flow of new patients, which I know you help your clients with incredibly well, but they're also marketing for team members. And the thing that really is attractive to team members is, yes, of course, they're looking for a competitive compensation plan, but they're looking for a healthy culture to join. They want a team that they feel safe. They want a team where they can have fun. They want a team where they feel that they can grow themselves professionally and that they can really, that team is going to invest in them and that they can really work together as a team. And so that's a huge thing. I remember years ago, and this was probably like 2021, 2022, when like things were really, it was a little rough there for a while. Uh, and dentists are really just kind of recovering from all of that. And I had a conversation with the dentist who was interested in coaching. She's like, I keep hearing about culture. Like, is that really even something that I need to worry about? And so I said, well, you just told me respectfully that you lost two hygienists in the matter of 3 weeks. So yes, I would say culture is something that you need to be concerned about.
Well, and I think it's actually everything. You know,
Yeah.
in what I teach in the Champion Dentist program, it starts with the mindset of the clinician owner, he or she. Look, you can be a little blunt and say, look, the rule is don't be a jerk. Okay,
Yeah.
that's one perspective. But what do we do in our program? Well, we sit down, we have a leadership team, we develop a leadership team. And one of the things that we focus on is what are the values? The team
Mhm.
works with our coach on what is important to the doctor, to you. And those values are already present in the practice. They just quite often they're never codified.
Yes.
They're never, and so we actually work through that. And it's a fundamental exercise because what do we want? We want the right people in the right seats. If we don't have the right people in the right seats, boy, it doesn't matter what the business is, it's not fun.
No.
And we've got to get everybody rowing in the same direction, right?
Yeah.
When you have values that are clear and you're interviewing and recruiting and interviewing and coaching each other in the team based on the values of the practice, that becomes your lighthouse. It's the guiding light, right? Regarding are you living to the values or are you not
Yes.
living to the values? So that culture is absolutely critical. And I will tell you that Rachel, you're 100% on target. The way you create that culture starts with the doctor, his or her mindset, what are the values, and creating a leadership team. And this
Yeah.
is an area where a lot of doctors, they're frustrated because they didn't go to dental school to learn how to manage a complex small business. Dentistry is a complex
It
small
is.
business. And certainly that's where my team comes into play because we're able to take that doctor and go from good to great
Yeah.
to have the life and the lifestyle that they want. And when you got that sense of clarity amongst the team, as the leadership team becomes happy, healthy, and whole, and is cohesive and accountable and disciplined, guess what? So goes the rest of the practice
Yep.
because it is matriculated down in a very deliberate way. So that culture is really important. Beyond that, what are the other key things that come to mind for you?
Well, and I'll say, if we can, before we leave culture too, is it's real difficult for a potential candidate to know what your culture is. So you've got to show them, and there's some ways that you can demonstrate that. You can have video on your website that highlights your team. You can have a careers tab on your website and have videos from your team members on why they love working there. You can put links in your job posts to your social media. You can have images in your social media that show you and your team, at a health fair or doing some type of charity work or just having a good time together. So you do have to show that. You have to have a tangible reflection of that culture for those that you're trying to attract. But also, if you have a healthy culture, you're going to be more likely to have your existing team members recruiting others. They're
Yeah,
like, this is a great place to work. You need to come here.
yeah. Um, and it's just a matter of deliberate effort, isn't it? And
Yeah,
this is where I
it
think
is.
doctors can sometimes be intimidated or frustrated
Yeah.
or bewildered, is you don't have to become Miss or Mr. Motivation, Miss or Mr. Wonderful. It's, be who you are.
Yeah.
But
Right.
you have to come from the perspective of the mindset and the value and how you want that practice to operate. And certainly if the practice is operating with a high degree of stress, relating to systems and operations, and the doctor's struggling to make payroll. These are all things that are going to make it very difficult for that doctor's mindset to be supportive of a strongly positive culture.
Yeah.
So you can have the greatest hygiene perio program possible, but boy, if it's not underlaid by a really strong
Mhm.
systems foundation and a strong culture, it becomes very difficult to have long-term peace of mind, long-term success.
Yeah.
Let's talk about that you've got the culture, you're confident in the vibe that's existing in the practice, and now you've brought on this individual that you're really excited to have on the team. What do you offer that helps with that practice in the whole process of onboarding?
Yeah, that's a great question, Mike. So with our clients, we do offer, and this, in fact, this is something that we're developing right now, to have this as a more robust piece of our coaching, support, is to have a really clear system that they can follow for onboarding. So, for example, a lot of teams are really desperate to find a hygienist, and they've got this schedule backlog. So the the initial thought is like, let's just get this hygienist in here. Let's get his or her schedule full and let's start like working towards this backlog. But what we recommend is really look at how you can integrate this person into your practice. And that is not giving them a full schedule on the first day,
Mhm.
right? Give them an experience, let them meet everyone, have 3 or 4 days of shadowing where they're contributing to the team, right? They're helping with sterilization, they're observing, they are, maybe the hygienist needs some help seating a patient or turning over a room. Like they're there helping, they're supporting, but they're also learning the systems, they're learning the language, they're really learning from, those other team members that you want them to learn from so that they can really feel confident when they do sit down in that chair and start seeing patients. So that's just one, I would say, element is really consider investing in that shadowing time for a new team member, regardless of their role, so that they really have the opportunity to be set up for success and they have time to build relationships too with the other team members.
Rachel, yeah, you just made a point that is so important. In operating a small business, and I developed numerous small businesses from scratch, my father used to say, wisdom is a summation of experience, mostly mistakes. I've
Yes.
gone through the mud, the blood, and the flood. I've made the mistakes. But one of the most important things I learned was the importance of training
Yes.
and setting people up for success. To
Yes.
to pick up on a term that you said, it's so important. And in the Fortune 500, people will be there for a month, six
Yes.
weeks before they are expected to start doing something. They go through
Producing.
rigorous
Hmm.
training. And this is something I interviewed Dr. Sharon Blyler in Jenkintown, Pennsylvania. She learned this from her kids in Fortune 500 companies. They go through a whole bunch of training where they're
Yes.
and they are not productive for literally a number of weeks.
Hmm.
And Dr. Sharon does this in her practice, Noble Dentistry. People sit and watch and shadow and learn and role play and get that opportunity to be set up for success. Boy, that's really important. That's a great insight. I completely agree with you. Rachel, for someone to reach out to you, and guys and gals, you should reach out to Rachel because hygiene's the funnel. It's the funnel from which everything flows in your practice. You know this. How do people find you?
Our website, Inspired Hygiene, is a very great resource. In fact, on there you will see a tab that says free resources or free guides. And there's actually a resource there that is 17 tips to attract a hygienist to your practice. So I would encourage you, whether you're looking for a team member, any team member right now or not, go grab that because it's going to give you some ideas for how to craft a really attractive ad so that you can be ready when the time comes, or you can even put the ad out even before you need to hire someone, even better, right? And just, have that funnel going. So Inspired Hygiene is a great resource. You will see on there, there's a link to click to schedule a discovery meeting. And our discovery meetings are very, as Mike mentioned, they're very robust. So we have the practice owner share some data with us around their hygiene department. And we really try to look at that and give you very specific suggestions of how our programs could help you get a really strong return on your investment and achieve the goals that you're looking to do, in hygiene. So yeah, reach out to us that way. You can email clients at inspiredhygiene.com, and we would be more than happy to have a conversation. No pressure, just to see how we might be able to help.
Well, and everybody in the episode notes, everything that Rachel just described, it's all there. So you're going to be able to find her and have a great conversation about
Yeah,
how to go from good to great when it comes to your hygiene program. Rachel, thank you so much
my
for your
pleasure.
time today. It's been a privilege and an honor to be with you. I'm so excited that you are in dentistry doing these great things. Hygiene, as I said when we sat down, dentistry is a team sport.
Yes.
Hygiene is one of those key positions, and it's a critical function in the success of any dental practice. Thank you so much for your time, guys, gals. Reach out to Rachel. I know she and her team are going to take great care of you. Until next time, cheers.